Good morning, everyone, and welcome to the Nutrition and Wellness for Myeloma chapter, brought to you by the Myeloma Community Program by HealthTree. My name is Audrey Burton-Bethke, and I am the Myeloma Crowd Community Manager. I'm going to be sharing some slides with you today in order to do some announcements. Just one moment, as we always get these things ready beforehand, and yet they don't show up the way that you want them to. So one moment, and then I promise I'll be sharing the screen. I hope all of you are having a great day today. It's Friday, and in the United States, it's Memorial Day weekend, so that's an exciting time for us. Okay, so let's get started. Welcome, like I said, to the Nutrition and Wellness for Myeloma chapter. This event will be recorded and it will be sent out 24 to 48 hours after this event has concluded. As always, I'd like to thank our sponsors, without whom this event would not be possible: Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology. So today's topic will be imaging manifestations of common Western diseases. You may remember Dr. Urbi Shah, who helped launch this chapter with a series of talks regarding modifiable risk factors for myeloma. The recordings of her session have been viewed over 1,000 times. Because of her efforts to grow this chapter and coordinate with several specialists across the country, we have had amazing speakers in this group covering how good nutrition can positively affect different areas of our health, such as heart health, diabetes, sexual health. Today we get to hear from Dr. Natasha Wehrli, a fantastic radiologist at Cornell with strong interests in nutrition. She is going to speak to us today about how the radiologic and imaging findings relate to poor nutrition. It is now my pleasure to introduce Dr. Wehrli to you. Natasha E. Wehrli, MD, is a board-certified radiologist specializing in body imaging. She is an assistant professor of radiology at Weill Cornell Medical College and assistant attending radiologist at New York Presbyterian Hospital Weill Cornell campus. Dr. Wehrli earned her BA in economics from the University of Pennsylvania and was elected to the Phi Beta Kappa Society on graduation in 2002. She remained at Penn and was awarded her MD degree from the University of Pennsylvania School of Medicine in 2007 and was elected into the Alpha Omega Alpha Medical Honor Society. Dr. Wehrli did a transitional internship year at Mount Sinai Hospital in NYC before completing a residency in diagnostic radiology at New York University Langone Medical Center. This was followed by a year of fellowship training in body imaging, also at NYU Langone Medical Center, where she was awarded the Fellow of the Year Teaching Award by the radiology residents. Dr. Wehrli joined the Weill Cornell Medical and College Department of Radiology as a faculty member in July of 2013. Her clinical expertise is in body imaging. She interprets CT, MRI, radiographs, and ultrasound studies of the abdomen and pelvis, as well as the whole body, PET-CT. Dr. Wehrli's research interests include the role of dietary factors in the development of common disease processes and the benefits of plant-based nutrition and restoring a healthy gut microbiome, in treating those conditions. In addition to clinical and research activities, Dr. Wehrli is an active and involved teacher of residents, fellows, and medical students. So Dr. Wehrli, the time is now yours. Let me, sometimes it makes me prompt you to turn on your video. So let's make sure that that works and then we can get started.
Great. Can everyone hear me okay?
Mm-hmm.
Okay. Thank you so much, Aubrey, for that introduction. And yes, I'm a colleague and friend of Dr. Urbi Shah, who works right across the street at Memorial Sloan Kettering. And her and I share an interest in the role of nutrition in common Western disease processes. For her, it's very much oncology focused. For me, I will describe a little bit of some of the common diseases I see that are not oncology related. I will go ahead and share my screen. 1 second. All right. So hopefully everyone can see my screen. There you see a whole body MRI. That's not actually an imaging study we do very often, but I thought it kind of showed sort of some of the disease, or I should say some of the solid organs that I look at on a daily basis. So just to talk a little bit about what Americans are eating and why it's an issue. And you can see here some of the trends in meat consumption that have occurred since the early 1900s. And it seems that overall, poultry has demonstrated a very significant rise since the early 1900s. Definitely since the 1970s and 80s, a lot of that poultry is from factory farmed meat, which creates a whole other host of health issues. Red meat consumption did have a very high peak in the 1970s and 80s. Now it seems to be trending down, and pork is pretty much steady throughout. But as a whole, you can see mainly because of poultry consumption, meat consumption overall has trended steadily up since over the last century. Cheese consumption, similarly, very significant rise, especially in the second half of the 1900s to the present day. Has become a very popular food, as has sugar consumption. So as you can see here, many trends, not necessarily good ones. This is all from USDA data. So in terms of food as a percentage of calories, what are Americans consuming? So you can see a staggering 63% of food comes from processed food. So that's added fats and oils, sugars, and refined carbohydrates. 25% of food comes from animal food, and cholesterol is actually only found in animal foods. And I'm sure Urvi mentioned that as well. And only 6% of total calories are coming from whole vegetables and fruits. Between 88 and 94% are coming from processed and animal foods. So the other issue is, why is it so cheap to buy unhealthy food? Well, part of that is because of the money where subsidies go. So very little money is actually put into subsidizing healthy fruits and vegetables, less than 1%. Nuts and legumes, it's a very small 2%. There's a fairly significant amount of subsidies that go toward grain production. The problem is a lot of that grain is actually to feed livestock, and then a lot of that grain is also created into ultra processed foods. And then you can see here, sugar, starch, oil, and alcohol takes 15% of subsidies. So maybe we should be asking why real food is so expensive. We should stop asking why real food is so expensive and start asking why processed food is so cheap. And I think the graphics I just showed you kind of give you a sense of why that is. What are the leading causes of death in the United States? So this was from 2008, but not much has changed. The top killers are heart disease, cancer, and strokes, followed by chronic lung diseases, accidents, diabetes, Alzheimer's, pneumonia, kidney diseases, and blood infections. So as you all know, this past year has been a little deviation from that. COVID-19 in 2020 was the third leading cause of death. But in a typical year without a pandemic, a lot of the top causes of death are diet related, as you can see here. And that is basically collectively responsible for 70% of all deaths worldwide. Nevertheless, we spend more than any other developed country on healthcare expenditures. Here you can see health consumption expenditures per capita. In 2017, US beat out the second highest country, which was Switzerland. And an average country spends about half of what we spend on healthcare. And yet we have the lowest life expectancy at birth for comparable countries. So here you can see an average life expectancy for men and women at about 85 and 80 years. In the United States, it's about 81 and 76 years. And this was the most recent data available from 2018. So US healthcare costs hit a record of 3.65 trillion in 2018. And I don't have the data from 2020, where I assume it's probably higher. Again, a lot of that is related to the pandemic, so kind of hard to know how to interpret that data. But certainly up until 2018, we had a pretty high peak. And that was the highest in the developed world. And yet life expectancy continues to decline. Rising rates of chronic disease, suicide, opioid-related deaths are all major factors. And life expectancy in southern states is actually lower than in other states. So this is a nice diagram that one of, I don't know if you're familiar with Dr. Dean Ornish. He has created a lifestyle medicine program for cardiovascular disease, and he likes to share this slide. And he basically says this is how we're practicing medicine when it comes to a lot of lifestyle-related chronic illnesses. Basically, we're too busy mopping up the overflowing faucet than to just say, wait, let somebody please turn off the faucet. So, you know, we have medically managed diseases, but really we're not getting to the root cause of the issue. So this is me interpreting a CT colonography. I work in a busy, multi-centered academic practice in New York City at Weill Cornell. I interpret both inpatient imaging, so hospitalized patients, as well as outpatients, so a lot of oncology, but as well as a lot of non-oncology and some emergency medicine as well. What are some of the common reasons that people get a CT scan or an MRI scan or an ultrasound in the abdomen or pelvis? So cancer surveillance is a huge part of it. Here at Cornell, we see a lot of gastrointestinal cancer. So I read basically everything below the diaphragm to the groin. So not really in the chest, not really in the brain, but everything kind of in your central abdominal organs. I see a lot of gastric cancer, colorectal cancer, so gastrointestinal pancreatic cancer, breast cancer, lymphoma. I do see multiple myeloma as part of my day-to-day work, renal cell carcinoma, bladder cancer, and GYN malignancies. There's also a lot of abdominal pain workup. So some common things we see are diverticulitis, appendicitis, gallstones, inflammatory bowel disease, bowel obstruction, kidney stones. Liver imaging is pretty frequent. So we see non-alcoholic fatty liver disease, cirrhosis, hepatocellular carcinoma for screening and surveillance. And finally, gynecologic indications, very commonly fibroids, endometrial polyps, ovarian cysts, and some rare transplant imaging. So what are some common diseases linked to dietary factors? So many of the things that I already described, and which I'll go into in more detail today, are not surprisingly gastrointestinal diseases. So everything in the spectrum from non-alcoholic fatty liver disease to non-alcoholic steatohepatitis. So that's basically when fatty liver disease progresses to an inflammatory condition, and that's a predisposing factor for cirrhosis. Gallstones, which can lead to acute cholecystitis or gallbladder inflammation. Gallstones can also cause pancreatitis. Diverticulosis, I'll describe that in more detail in a later slide, which can also predispose to something called diverticulitis. Inflammatory bowel disease, which is on the rise in most developed countries. That includes ulcerative colitis and Crohn's disease. And then, as I mentioned, a lot of the gastrointestinal cancers, extending all the way from the upper GI tract, esophagus, down to the colon and rectum. We also have a lot of GU, genitourinary, basically diseases that we see, kidney stones, renal insufficiency, which is kidney failure, kind of a slow insidious kidney failure, recurrent urinary tract infections, big prostate glands, prostate cancer, PCOS, endometriosis, fibroids, endometrial cancer, ovarian cancer, diseases involving the vascular system or autoimmune disease, or in some cases, the lymphatic system. So atherosclerosis and hypertension, very, very common. Diabetes, very common. Lupus, rheumatoid arthritis, some of the more common autoimmune diseases. Again, those are also on the rise. Lymphoma. And then finally, diseases of the musculoskeletal system, degenerative disc disease, osteoarthrosis, gout, multiple myeloma. Multiple myeloma, I put it under musculoskeletal because it does affect the musculoskeletal system, but it obviously is also, involved with hematologic disease. So I'm just going to go through a few cases of things that I see on a typical day, and these are just examples of the types of cases I see pretty much every day. I try to pick generally young patients because a lot of people think, a lot of these diseases happen in older individuals, and that's not true. We're seeing a lot of this stuff in fairly young individuals, And then it continues to progress with age. And so here's the first case. This is a 30-year-old woman who was incidentally noted to have abnormal liver function tests or elevated liver enzymes, something called AST and ALT during routine blood work. So a lot of times when they see that, they think, okay, patient could have something wrong with their liver. Let's get an ultrasound. So this was a static image of the right upper quadrant. And you can see this is the liver, and that's the right kidney right next to it. And here is what we call a cine image. So it's like a short video where we kind of scroll through the liver. We're looking for anything focal. We want to evaluate the whole organ on ultrasound. So static images won't capture that. So we look at both static images as well as short videos in multiple planes. Now here is a normal person for comparison. So here again, we see the liver and the kidney and another cine image or short video kind of scrolling through the right hepatic lobe. So let's look at these compared to one another. Here we have the liver and kidney in our patient with abnormal liver enzymes, and here's the liver and kidney in a normal control. What do you notice is different? So in a fatty liver, or hepatic steatosis is the medical term, the liver itself appears brighter or more echogenic is the ultrasound term compared to a normal liver. This is a different patient, same diagnosis, this time on a CAT scan. So when we review CAT scans, we look at static images, but we also scroll through the entire study in multiple planes. So this is looking as if you're looking at the person head on. So we're scrolling from front to back, and that's the outline of the liver. So, scroll through, look at it. There's no contrast given on the scan. So here we have a fatty liver, and I will tell you the measurement is about 20 centimeters, so it's also an enlarged liver. And if you measure the density of the liver, it's actually very low. Also note that this patient has a lot of what we call adipose tissue or fat interdigitating between their internal organs. So that's called visceral adiposity. There's also subcutaneous adiposity. So this person is probably of larger BMI. Compare that to a normal liver. You can see it's smaller, it's denser, and the patient also has less adiposity. So less visceral adiposity, less subcutaneous adiposity. So what does non-alcoholic fatty liver disease have to do with diet? So many studies have been done on this. I'll highlight a few key ones. This is a study from 2018 in a Dutch population. It was a longitudinal study done in over 1,000 adults. They did a dietary intake questionnaire, and they calculated something called the fatty liver index. So it was a non-invasive way to estimate liver fat based on their triglyceride levels, which are a serum marker, GGT, another serum marker, their body mass index, and their waist circumference. And then they made adjustments for total calorie intake and a whole host of other factors. And once they adjusted for all of those things, they looked at if there were any particular dietary trends associated with a higher fatty liver index. And what they found was that people who had fatty livers tended to eat more animal protein, so more meat, more dairy, more soft drinks. So, refined sugar, definitely not good. Less carbohydrates, vegetables, and fiber. And they found that people who ate more vegetable protein, also there's a lot of protein in vegetables themselves, but also legumes and whole grains. They were found to have a lower fatty liver index. Here was a different study. This is from 2018, and this was a very different type of study, but this was a 3-week prospective controlled feeding study in overweight patients. So they basically put people in 3 groups, and they were randomized, and each group was instructed to eat an extra 1,000 calories of one of different things. So one group ate an extra 1,000 calories of saturated fat in the form of butter and cheese. Another group ate an extra 1,000 calories of unsaturated fat in the form of olive oil, pesto, pecans. And the third group were instructed to eat an extra 1,000 calories of simple sugar in the form of juice, sugar sweetened beverages, candy. And what they found, so they used something called MR spectroscopy. So it is sort of an imaging technique, but to calculate directly calculate the fat content, and they found that it increased the most by 66% in the saturated fat group, the second highest in the sugar group, and the least in the unsaturated fat group. So that's, what we call like monounsaturated fats, polyunsaturated fats, a lot of the fats you find in certain vegetables, olive oil, for instance. So this was an interesting study. And then finally, this study done in 2019, it was a multi-ethnic cohort study. They looked at many different ethnic groups, and they had almost 3,000 patients who had confirmed non-alcoholic fatty liver disease based on imaging and lab work. And then they took a huge group, almost 30,000 age-matched controls. They were all given food frequency questionnaires. And what they found was red meat, processed meat, poultry, and dietary cholesterol were all associated with higher incidence of non-alcoholic fatty liver disease in all ethnicities, whereas dietary fiber was inversely associated with it. So here is, this is actually kind of a cirrhotic looking liver, but that's not unrealistic because non-alcoholic fatty liver disease is associated with cirrhosis. And here's what it looks like if you look under a microscope, and all those little white lobules, that's fat adipose tissue. It has a very high global prevalence of up to 40%, and it can progress to what I said was non-alcoholic steatohepatitis. So basically it's just fat deposition, which eventually becomes inflamed, and that will soon become the #1 cause of cirrhosis, liver cancer, and liver failure, projected to be in the next decade or so. Right now, I think infectious hepatitis C, hepatitis B still are, and alcoholic liver disease are still the leading causes, but soon it will be dietary factors. Insulin resistance is also a key step in the pathogenesis, so it's very complicated. It's obviously not just diet. There are other factors, genetics, of course, but insulin resistance does play a role. But in terms of diet, we've seen from these studies and many others that saturated fat and cholesterol, as well as added oils and sugars, but to a lesser extent, appear to predispose to development of non-alcoholic fatty liver disease, whereas diets high in fiber are protective. All right, and I will have time for questions at the end if you have any, but let's move on to case 2. So this is a 68-year-old man who has epigastric abdominal pain and an elevated white count. So an elevated white count is just something we see when there's some sort of infection going on. So we do a right upper quadrant ultrasound because of the abdominal pain. And here we can see GB stands for gallbladder. So there's the gallbladder, and inside it, we see some gallstones. And then what else is going on? The gallbladder looks pretty distended and the wall looks kind of thickened. So that means it's inflamed. Patient's also jumping with pain as the sonographer is scanning him. And as we scroll through, we confirm big distended gallbladder with a wall thickening and multiple stones. Just for comparison, so you guys to know what a normal gallbladder should look like. This is a normal gallbladder. The whole thing is not quite as distended. The wall is totally thin. There's no stones anywhere in the lumen, including the neck or the cystic duct. So the entire gallbladder looks free of stones. And we confirm that with these short videos or cines. Just to show you an example on CT. So here is the gallbladder on CT. It lives kind of right tucked under the liver. And here are some dense gallstones layering within it. And the gallbladder wall looks a little bit thick walled. And because the patient got in contrast, we can see it's hyperemic. So it's a little bit hypervascular, another sign of inflammation. Compared to a normal patient where the gallbladder is less distended, the wall is very thin and we don't see any obvious gallstones within it. So gallstones, what does that have to do with what we eat? So many studies have looked at this over the years. This is an old study back from the 1980s performed in Oxford. And what they did was they had 632 non-vegetarians and a smaller group of vegetarians fill out a medical and dietary questionnaire. And ultrasound was used to evaluate for gallstone disease. And what they found was non-vegetarians had a 2.5-fold higher prevalence of asymptomatic gallstones compared to vegetarians. And this, once they controlled for BMI, there was an association, but it was a little bit smaller. So obviously BMI is an independent risk factor, but still, obviously diet has some role. So this is another study from 2009, a smaller study, but basically they looked at 80 patients who had already gotten their gallbladder taken out for symptomatic gallbladder disease, which is essentially gallstone disease. And they found that there was a very strong female predilection for gallstone disease, and non-vegetarians in this study were 9 times as likely to have gallstones compared with vegetarians. When they looked at the composition of the stones, because there are different kinds that you can have, most of them were something we call cholesterol stones, or a mix of cholesterol and pigment stones. Pigment stones usually happen when there's a breakdown of blood products. So people who have like hemolytic anemia, much less common, but things like sickle cell disease can predispose to that. This was a study, more recent study from 2019, a prospective cohort study in Taiwanese patients. So a very large group, almost 5,000. And they split them into a small group of vegetarians and a larger group of non-vegetarians. They were given a food frequency questionnaire and underwent a comprehensive health exam, including serum lipid levels. And what they found was female gender and high cholesterol were high serum cholesterol were the 2 biggest factors associated with gallstone disease. Non-vegetarian women with high cholesterol were 3.8 times more likely to develop symptomatic gallstones compared with vegetarian women with lower cholesterol. So here's a gross specimen. Sorry, guys, if hopefully you've already had lunch but anyway, this is what a gallbladder looks like when it's removed for what we call cholecystitis. Gallstone disease has an estimated prevalence of 10% in Western countries. And basically they're at risk for something called biliary colic. So the gallstones can get lodged in the cystic duct and block it. So the gallbladder gets basically blocked, and that can cause a lot of right upper quadrant sharp pain. And if it gets infected or inflamed, then it's something that persists. It's not just an intermittent pain, but it's a persistent pain and inflammation, and it usually requires surgery to treat it. The majority of gallstones are made out of cholesterol crystals. So that's linked to cholesterol that's excreted from the liver into the bile. Risk factors, as we discussed, are female gender. They think this might be mediated by estrogen, obesity, dyslipidemia, or abnormal lipid levels, cholesterol, diabetes. So those are really the big risk factors. And it seems that plant-based diets, which are naturally lower in fat, devoid of cholesterol, and high in fiber, seem to have an inverse correlation with the risk of gallstone formation. All right, next case. This is a younger 34-year-old man, and he has all of a sudden really severe, sharp right flank pain, kind of radiating to the back, and then he's noticed some blood in his urine. So we suspect something's going on with kidneys. So we get a renal ultrasound. Here's the right kidney next to the liver. And all that black in the center is actually the dilated collecting system, something we call hydronephrosis. And he also has a kidney stone causing that obstruction. Here we do a short video to confirm dilated collecting system, big stone here, blocking the urine from coming out. So just to review, right kidney with hydronephrosis and a kidney stone compared with the normal kidney with no hydronephrosis and no obvious stones. What does that look like on a CAT scan? So here again, we're scrolling through front to back, and I'm going a little fast, but I can tell you the kidneys kind of hang out on both sides here in the back. And we can see one, there's some stones, on the other, there's some stones. So that's what the kidney stone. And just to note, this is a 34-year-old guy. He also has calcification of his aorta. So people think, again, heart disease, atherosclerosis are diseases of older age, and that's not true. We see atherosclerosis evident on imaging as early as, people in their 20s and 30s. And it can, on gross pathology, they can detect it even in children. So it's definitely a lifelong disease that starts at a young age. So in terms of kidney stones, a lot of people, I think, have misconceptions about what leads to them. And it's definitely multifactorial, but diet plays a significant role. And here's an old study. This was just a correlation study from the 1970s. It was observational. And basically, they were looking at correlations between rates of hospital discharges for treatment of symptomatic kidney stones and affluence in the United Kingdom. So they basically looked during a time of affluence and then a subsequent economic recession, and compared it with dietary trends. And what they found was no correlation between stone formation and refined carbohydrates, but they found a very strong correlation between stone formation and meat and seafood consumption. So, correlation doesn't mean causation, but it is an interesting trend and worthy of investigation. So this was a really powerful study. This was a randomized control study from the New England Journal of Medicine in 2002. And up until that point, basically people who developed kidney stones, because they had a lot of calcium in them, they were told eat less calcium. That was the urologist's recommendation, but it wasn't exactly evaluated that carefully. And so basically in this study, they did two different groups. So two different groups of people had calcium oxalate stones, and one was randomized to a diet that had normal amounts of calcium, but decreased animal protein and decreased salt. And the other diet was a low calcium diet, which up until that point was what they recommended for treatment of kidney stones. And what they found was after 5 years, those on the calcium only diet had no change in their frequency of kidney stones, whereas there was a 49% decreased risk of stone formation in the group that had switched to a low animal protein diet. So very compelling data. So there's other types of studies. A lot of them are very large studies. This was published in the Journal of Urology in 2014. And this was a large study where they looked at over 80,000 postmenopausal women, part of the Women's Health Initiative. So they were followed for 8 years and given food frequency questionnaires. And women in the highest quintile intake of fiber, fruit, and vegetables, and no prior history of kidney stones, had a 25% lower risk of developing kidney stones in the 8-year time interval. So kidney stones. Prevalence has increased by 70% in the last few decades, and it's very common. It occurs in about 1 in 20 people in the US population. I see them a lot incidentally on scans for other reasons. And most of these stones are going to be calcium oxalate stones, but uric acid stones are also common. And those are both associated with animal protein intake. And the reason for that is because animal protein has a lot of sulfur containing amino acids. So that increases the acid load to the kidneys and lowers the urinary pH. Animal protein also reduces urinary excretion of citrate, which is an inhibitor of stone formation. And it increases urinary excretion of calcium, oxalate, and uric acid. So those can form crystals and form stones. So one thing I didn't mention, water consumption, you always want to stay hydrated. So increasing water consumption is something we recommend for all stone formers. Reducing sodium is also important. But one thing that kind of gets lost in the message is a plant-based diet, high in natural alkaline legumes, fruits, and vegetables can really lower the risk of stone formation. All right, case number 4, 52-year-old man with severe left lower quadrant pain, fever, and chills. So here we're going straight to CT. We're worried about something brewing in his bowel. So you can see there's oral contrast, there's IV contrast. These are all bowel loops. And something catches my eye here in the pelvis. Let's focus on that. Okay, there's something, a little collection of fluid with air and some soft tissue stranding around it. Looks like it's coming from the sigmoid colon. Here's what it looks like on the coronal. So this is diverticulitis. Here is a zoomed up picture of a colon with something that we call diverticulosis. So that's all these tiny little outpouchings coming off the bowel wall. And this is caused by intraluminal pressure. So we see it a lot more distally in the colon, but it can happen throughout the colon. And here is what that looks like when one of those little outpouching pops open and gets inflamed. So then you see all this haziness around the colon. And that's what we call uncomplicated diverticulitis. When it progresses to an infection and an abscess, that's complicated diverticulitis. So here we see diverticulitis with an abscess. Here's a colon full of diverticula. We see this very commonly. They're on the right side, they're on the left side. And here's a normal colon for comparison. Zooming in, we don't see any of those little outpouchings. So what does diverticulosis have to do with diet? So this has been studied for a long time. This was an old study from the South African Medical Journal in 1982. And basically what they did was they looked at a part of Africa and Johannesburg where diets were mostly plant-based, very high fiber intake. And they looked at close to 3,000 patients on autopsy and found no diverticular. Oh, sorry, both autopsy and barium enema examinations. And they did not see any diverticulosis. And yet in Western countries, especially because we have data from colonoscopies, up to 2/3 of adults develop diverticulosis by the age of 80. So it's, diverticular disease is clearly a disease of the 20th century. And it seems to be correlated with the rising consumption of refined carbohydrates and meat, leading to an overall decrease in whole plant sources of dietary fiber. This was a study published in 2019 in the American Journal of Gastroenterology, and they looked at a large number of women in the Nurses' Health Study over the course of 14 years. They were given food questionnaires that were filled out every 2 years, and up to 4,343 cases of diverticulitis were documented. They found that women in the highest quintile of fiber intake had the lowest incidence of diverticulitis, whereas fiber from fruits, and they found especially pears and apples and whole grains were the most protective. So really high fiber foods seem to be very protective against this disease. This was a study published in October 2019 in Intestinal Research, and it was a retrospective cross-sectional analysis of 1,316 subjects undergoing colonoscopy in Korea, including 658 vegetarian Buddhist monks and 658 age-matched non-vegetarian controls. And they found that the biggest risk factors for developing diverticulosis were age, male gender, and a non-vegetarian diet. Vegetarianism was found to be protective even after adjusting for confounding factors like body mass index. So diverticulosis is extremely common. It affects over 50% of adults over the age of 80 in the Western society, and it's characterized by small outpouchings in the colon caused by slow colonic transit and stool retention, constipation, increased intraluminal pressure. This can predispose to GI bleeding. A lot of times these are not bleeds that we can detect on imaging, but what I do see are diverticulitis. So that's when one of these little outpouching bursts and becomes infected and inflamed. So as I mentioned, age is obviously a risk factor, male gender, BMI, and low fiber diets. Whereas whole food plant-based diets seem to be protective against developing this disease. All right, final case. This is a 37-year-old woman with irregular menses, infertility, and facial hair. So here we see her right ovary. We're looking at it both in longitudinal and axial planes, and it looks pretty big. The ovarian volume is increased. It's almost 30 ml. Normal is 10 or less. And we see that there's a lot of these tiny little peripheral follicles. Same thing on the left side. Again, big volume. So big enlarged ovaries with multiple tiny peripheral follicles that sort of look like a string of pearls is how they describe it. And, we like to confirm this. We do little videos to look through the ovaries. And this is what one looks like. Now, here's a normal person for comparison. This ovary is much smaller. The volume is 7 ml. And when you scroll through, we see bigger follicles. And on the left side, we see corpus luteum. So that's a normal follicle that just ruptured for the during the woman's menstrual cycle. And here again is that abnormal ovary for comparison. So this is polycystic ovary syndrome. And that's when, it's not an imaging diagnosis. We need labs to confirm, but imaging can help suggest the diagnosis. And it's when we see large ovarian volumes with numerous peripherally displaced follicles, all measuring under 1 centimeter. There's no dominant follicle, so the woman is not having normal ovulations. This is what it looks like. This is an MRI image, kind of looking on FOSS. And you can see the left ovary here, kind of string of pearls sign in the ovary on the left side and in the right side. Then we scroll through and we just confirm big ovaries, numerous small follicles, no dominant follicles. So PCOS is an interesting disease. And this is, there are many factors that contribute to PCOS, but diet is definitely related. So this was a review article published in the journal Nutrients in 2015, investigating the role of something called advanced glycation end products in PCOS. And these are reactive molecules that exist in high amounts in grilled meat and cooked fast food. And they found that elevated levels of advanced glycation end products were associated with inflammation, insulin resistance, diabetes, and PCOS. And basically, they think that ages interact with pro-inflammatory receptors on many tissues. And deposition of these end products in the ovaries may interfere with normal follicular function and ovulation. So, is there any way that we can alter the clinical outcomes for these patients? Because PCOS is a big cause of infertility. So this was a randomized control trial published in Journal of Human Nutrition and Dietetics in 2018. 60 women with confirmed PCOS were randomized to 2 isocaloric diets for 8 weeks. So there was a test diet, which was pretty much kind of a standard diet, 35% animal protein, 35% soy protein, 30% vegetable protein. I'm sorry, that was the low animal protein diet versus the control diet with 70% animal protein versus 30% vegetable protein. And they found that those who actually adhered to the test diet had significant decreases in weight, waist circumference, insulin resistance, blood sugar, triglycerides, and they had improved hormone function after only 8 weeks. So that was very impressive. So polycystic ovary syndrome is common. It affects about 1 in 10 women. And basically these women have ovulatory dysfunction, so their periods are irregular. They have insulin resistance. They may have hyperandrogenism, so excess male hormones, which may lead to acne, facial hair. And they're at higher risk for diabetes, cardiovascular disease, and hormone-dependent cancers like breast and endometrial cancer. So diets high in saturated fat and advanced glycation end products. So really animal products, highly processed fast food, fried food, and intake of food with high glycemic index, so refined grains, sugars, seem to predispose to PCOS, whereas a low-fat, high-fiber diet with a low glycemic index, which is what a whole food plant-based diet is an effective strategy to manage symptoms of PCOS. So what should we eat? And you're going to get conflicting information on this depending on your source. And, it can be very hard to tease through, do we want to do a keto diet? Do we want to do a paleo diet? Do we want to do a plant-based diet? There's a lot of different information out there, and you kind of really have to dig through the science, and there's a lot of it. But I think the overall trend is eat more fruits and vegetables. Eat less fast food, definitely eat fewer refined grains and highly processed meats. So you want to favor unprocessed plant foods, limit processed plant foods and unprocessed animal foods. And if you can, try to avoid ultra processed plant foods and very processed animal foods. So this is the green light, yellow light, and red light system for what you should put on your plate. And this is from nutritionfacts.org. So just to highlight what are green light foods. So these are the ones you should eat the most of, non-starchy veggies. They say up to 6 servings a day. Really, you can eat just green light foods and you would probably be in pretty good shape. What's so beneficial? Very high in dietary fiber, packed with phytonutrients, very anti-inflammatory. So these are your dark leafy greens, your cruciferous vegetables, your root vegetables, asparagus, tomatoes, garlic, and onions. So those are the allium vegetables. Mushrooms is not technically a vegetable, it's in the fungi kingdom, but basically all of these foods are really what you should prioritize. Starchy vegetables, you should also have a few servings a day. Again, healthy carbohydrates, lots of fiber, lots of phytonutrients, low in fat. These are some examples. Fruits, 2 to 4 servings a day. Again, fiber, phytonutrients, and not all fruits are considered the same. I mean, a banana is not going to have the same, it's not going to pack the same punch as blueberries. So really the more pigmented the berries, the better. But all of these have health benefits. Whole grains, so 5 to 8 servings a day. These have, when it's a true whole grain, they're a great source of fiber, great source of protein. They've been shown to lower cholesterol. And if you're if you are on a gluten restricted diet because of celiac disease or gluten intolerance, many of these are gluten-free, including brown rice, amaranth, quinoa, oats, sorghum, buckwheat, and teff. Legumes and minimally processed meat alternatives. And by that, I pretty much mean tofu and tempeh and maybe hummus as we see here. But legumes are so healthy. They've been associated with the blue zones, which are the longest living populations in the entire world. And there's scattered little pockets in the world of people who have the most longevity, and they all have the same thing in common. They eat legumes in high quantities. So all the beans, lentils, edamame, tofu, tempeh, hummus, these are really good for you. Nuts and seeds. The one thing you have to just be careful with, if you're trying to lose weight, nuts and seeds do have a lot of fat, but it's heart healthy monounsaturated fats. I find that a handful of these can really help as a snack instead of a bag of chips. Go for the unroasted, unsalted variety, and that's the healthiest. But even if they have a little bit of salt, I still think that these are a great alternative to processed snack food. They have a ton of fiber, they have a ton of protein, they have other nutrients as well. Avocados, coconuts, again, limit those a little bit, but they can still be part of a very healthy diet. Now we're going into kind of the murky greenish yellow light foods, still fine. Just note that dairy alternatives can have a lot of variety. So I personally choose whole, organic, unsweetened soy milk, and I make sure that there's nothing called carrageenan, which is an emulsifier within it. So you just have to be a little bit careful about which dairy alternatives you choose. I think organic is best, and I find soy is easier to find organic than, for instance, oat. And then some of them may have these other things that you have to worry about. So the brand I choose is Silk, but there's plenty of options. Some yellow light foods. So now we're really going into that refined grain category. So white pasta instead of whole wheat pasta, white rice instead of brown rice, white flour instead of whole wheat flour. And basically the fiber has been removed from these grains. So what happens is you consume them, you don't have the benefit of the fiber, and your blood sugar spikes. Fruit, sugar sweetened beverages have different categories, but fruit juice falls in that yellow light zone where, you may have some small benefits from the phytonutrients, but the fiber's been removed. And so your body doesn't treat it all that differently from Coca-Cola, to be totally honest. Refined vegetable oils containing mostly poly and monounsaturated fats. I don't think these are all the same. I find that a little bit of olive oil, especially organic olive, if it's a high quality olive oil, is probably fine as a garnish. For cooking, I use a little bit of olive oil, avocado oil or grapeseed oil. But the problem with oils is that they're high in omega-6 and they're low in omega-3, and omega-6 is inflammatory. They also pack a ton of calories. So 1 tablespoon can be 100 to 120 calories with absolutely no fiber. So they, again, they're kind of predisposed to weight gain. And they may cause some endothelial dysfunction. So there's various studies, some are mixed, some suggest that they can affect heart disease, others not. So the different heart doctors who are in the plant-based camp, some of them say no oils, others say small amounts are okay. But certainly if you're gonna have oil, I would limit it as much as possible. Other yellow light foods, eggs and seafood, definitely a good source of protein. A high quality wild caught salmon or, certain fish may be high in omega-3s, but the problem is quality is all over the map. They also have a lot of choline. Choline is a precursor to TMAO. TMAO is associated with heart disease. Nowadays, our world is polluted, the oceans are polluted, and environmental pollutants are a very big concern, especially in larger predatory fish like tuna, swordfish, because they have something called bioaccumulation. So all of these environmental contaminants concentrate in the flesh because they eat smaller fish. They are often a source of cholesterol and saturated fat of varying quantities. farm seafood, not a good source of omega-3. And it's sometimes not clear if you're getting farmed or wild caught food, especially if you're ordering from, say, your local sushi place. There's no fiber in seafood. It doesn't have as much antioxidants as you would think. And then eggs, you know, kind of similar, very variable quality there. Other yellow light foods, processed meat and dairy alternatives. So most plant-based doctors will say if you're comparing a real sausage to a plant-based sausage, the plant-based sausage is probably better for you, but it doesn't mean it's health promoting because they tend to have a lot of oils and fats, and they tend to use a lot of coconut oil and sometimes palm oil, which is a saturated fat, which will really drive up your cholesterol. And then, you know, dairy alternatives, you know, a vegan ice cream is great, you know, at least you're not harming animals or whatever, but it still has a ton of sugar and it has a lot of coconut oil and saturated fat. Low-fat dairy products, you know, a lot of the saturated fat may be removed. If it's organic, that might have fewer environmental contaminants. You may have live active cultures in yogurt. A lot of yogurts still have a lot of added sugar though. Lactose intolerance is still a concern. Galactose may have some health harms associated with it. Animal protein in general boosts insulin like growth factor 1, which is associated with cancer. You may have estrogens in a lot of these foods that you're not even aware of. They can activate mTOR, that's linked with acne and other chronic inflammatory conditions. Cholesterol, no fiber, added sugar, all these things are concerning. Then we start getting into, you know, coconut oil, palm oil. For whatever reason, these have gotten a lot of attention in the media as health promoting, but they're not. They drive up cholesterol. They, you know, saturated fat is solid at room temperature. So just think about what that's doing in your body. If it's going to clog your drain, do you really want to put it in your body? There's no, often these are stripped of fiber. And then when we're looking at poultry, they describe white meat as kind of the more health conscious meat, but it actually is just as associated with cardiovascular disease. It has a ton of cholesterol. It's one of the biggest sources of dioxins, which are carcinogens, environmental contaminants. It also forms heterocyclic amines, which are also carcinogens at high heat. Trans fats, which are, you know, trans fats are banned as added, you know, to be added to baked goods, but they're naturally occurring in things like poultry and other meats. And then, you know, a lot of times you hear about salmonella outbreaks that are linked to meat. You cook the meat, the salmonella is dead, but the endotoxins associated with that may still be present, which can cause inflammation. So these are all things to consider when it comes to what we put in our bodies. And then we're getting into the red light food. I personally think these should be avoided, but certainly very limited if you're not going to avoid them completely. Because when you have something like cheese, you're taking all the potentially harmful effects of dairy products and concentrating them. So it's very high in saturated fat, very high in cholesterol, no fiber, higher in estrogen, more activating of mTOR, may have more pollutants in it, and added sugars, no fiber, all these other concerns as well. Fried foods, seafoods and meats, you know, especially fried. Like, you know, all of the same issues that I mentioned before. Carnitine, like choline, is a precursor to TMAO that's associated with cardiovascular disease. We have advanced glycation end products, which we discussed with PCOS. Environmental pollutants tend to concentrate in meat because these animals are consuming grains and other things from the environment, and they concentrate all these pollutants that are just naturally in our environment. Heterocyclic amines and polycyclic aromatic hydrocarbons, those are molecules that form at high heat cooking. Again, we have the concern of bacterial endotoxins. Fried foods also have a lot of acrylamide, which is associated with cancer formation. Cholesterol, saturated fat, the list goes on. So really try to avoid those things. And then I think in the worst categories, the ultra processed meats, sugar sweetened beverages. These have other added compounds that can be harmful, like nitrates, ammonia, processing chemicals. They have a lot of heme iron in red meat, something called new 5GC, which is found in a lot of mammalian red meats and organ meats, also associated with, it's a sugar, but it's associated with cancer formation, all of these other things. So you can see we're really losing any benefit here when we get to the processed meats and sugar sweetened beverages. So what about organic versus non-organic? And this is something that comes up frequently, and everyone has kind of a different limit for what they're willing to tolerate. And the truth is, a lot of the studies done to show benefits of plant-based diets were done with conventional produce. Nevertheless, pesticide levels are higher with certain types of fruits and vegetables. And the way I like to think of it is the ones where you're going to eat the peel, or there is no peel, it's just a leaf. It's really hard to get those pesticides off. So if it's not cost prohibitive for these top 12 dirty dozen fruits and vegetables and soy products, I try to choose organic when I can. Onions, bananas, avocados, things like that, I'm not always as, concerned because I'm removing the peel. So I think there's probably less of a pesticide load in those cases, but some people choose to be all organic, and that's fine too. You can try and soak your fruits and vegetables. I don't know how, efficacious this is, but it may remove some of the pesticides. And I already talked about that. If you are going to do a plant exclusive diet, and when I say plant-based, I mean most, it can be anything from plant slant, so slanted towards a plant-based diet, to plant predominant diet, to completely exclusively plant-based. If you're going to be completely exclusively plant-based, you should supplement vitamin B12. It's a bacterial derived vitamin, also known as cobalamin. And basically, we've stripped it from our food supply because we chlorinate water, we use pesticides, we remove soil from our produce. So basically, all of these natural sources of bacteria that we used to eat with our food and our drink are no longer there. And animal products actually contain B12 because they're contaminated with bacteria, including, I hate to say it, fecal bacteria. Livestock are given supplements with B12, so it concentrates in their flesh because of that. But the bottom line is actually B12 deficiency is very pervasive in Western society in all people, regardless of diet. And above 40% of all individuals above the age of 50 actually are shown to have lower, borderline low B12 levels. So I think everyone should really be aware of B12, should probably supplement B12. I recommend about 1,000 micrograms every 2 to 3 times per week. And if you have something called MTHFR mutation, they recommend even more supplementation. And in that case, methylcobalamin is the better component. You can also take cyanocobalamin.
Dr. Wehrli, I'm sorry to interrupt you. I just want to make sure that they have enough time for question and answers.
Sure. And I think I have 1 or 2 more slides.
Okay, perfect.
Just some of the books that I think are great to read on the topic. Of these, not many of them describe what the best diets are for cancer, but this one, Breast the Owner's Manual, is great, written by a breast oncologist. And then these are all some of my favorite plant-based health documentaries. These are just some websites that I'll scroll through quickly, and feel free to take a snapshot of these. And then these are just some of the meals that I make. This is my husband grilling some veggie kebabs. This is my son, he's now a year older than this. But this is where he was, excitedly eating the inside of a burrito. And that's it. So here's my contact info. I have an Instagram account. Feel free to reach out. And of course, I'm happy to answer any questions that you might have.
That's great. Thank you so much. I loved your presentation. I was so fascinated, especially by the imaging. And I love that you compared, the unhealthy to the healthy, because that helps us understand what really is going on in our bodies. And I also like that you emphasized the different lights of what foods are appropriate and what foods are not. We have a couple questions coming in. So one question is, how can multiple myeloma patients get enough protein with a vegetarian diet when the volume of vegetables and grains isn't easy to consume?
Okay, that's a great question.
And if you want to stop sharing your slides so they can see you more clearly, sorry.
So, the amount of protein that we actually need to eat is a misconception that vegetarians get significantly less protein. If you, I don't have the studies to share with you right now, but one of the documentaries that I recommended is called The Game Changers. And they actually showed comparisons of people eating completely plant-based diets versus the standard omnivorous diet, and the amount of protein was the same. And also people were consuming about 30% more than their daily requirement. So protein insecurity is what I call it, is common, but it's not validated by science. Protein deficiency is not something we see in the Western world. You really have to eat a very calorically restricted diet to have issues with protein deficiency. So I think if you eat a standard amount of food, and I understand that people who are getting chemotherapy or other things, there's other considerations, and certainly you would want to work with a nutritionist. But it's not hard to get protein, especially if you're, emphasizing the foods that I emphasize, those green light foods. You'll do great.
Okay, awesome. That's great news. Dawn was wondering, why is there no omega-3s in farmed seafood?
So that's really interesting. So basically, a lot of the omega-3s come from algae. And interestingly, vegans can have lower levels of omega-3s, and the clinical significance of that is unclear. So in addition to B12, some people will recommend that you take an algae oil supplement, which is kind of the cleaner version of a fish oil supplement. It's also better for the environment because it doesn't require mass, consumption of fish to produce. But basically in factory farms, fish are given all sorts of strange diets. Fish pellets can have ground up eels. They can have ground up, small fish, but they're not getting as much of the natural algae as a component of their diet. So they tend to have higher saturated fat and less omega-3. So it's definitely not the healthiest.
Yeah, that makes sense. What about, so we know that diarrhea is a common side effect for a lot of the treatments that these patients are getting, but plant-based foods sometimes tends to make it worse because of just the nature of the food. What is your recommendations in that case?
Yeah, no, again, something very, this is a unique population, and you have to take into consideration side effects from the medications. And there are definitely some plant-based foods that are going to be a little easier on your system. So, I say caution with the refined grains, but if you find that white rice is a little easier on your system than brown rice, then do that switch. And same with pasta, bananas. There's some fruits that are definitely not as fiber intensive that you can eat that I think should be easier on your system. And it's definitely a gradual process. If you're going from eating a diet that's low in fiber to a 100% plant-based diet, I don't recommend doing that overnight. I think you should slowly transition into it because your body needs to adjust, and you're going to have a lot of gas and bloating basically if you don't take your time with it.
No, that's great advice, because I've found that too. Like, even as I make the transition, it has to be slower than I'd like to become, whole food, plant-based overnight, but that's just not realistic for the side effects that it brings on our bodies. Do you have a plant-based yogurt that you'd recommend?
I do. So I really like Foragers. It's made out of cashew milk, and it does have an emulsifier in it. That's the only thing that I'm not sure, I don't eat a lot of it, but son loves yogurt, and he's going through a phase where he's not eating anything healthy these days. So, we try to find things that we can make for him. So what we do is we make smoothies and then mix it with yogurt, and we buy the unsweetened kind. And it has live active cultures, and it's all organic, and it really has very few ingredients. So I think that's a great option. There's make homemade yogurt, but it's not, I find it to be a lot of work. So
yes, I agree. I was just gonna say, I have a 1-year-old, and we're going through the same thing right now, that I'm like, you cannot eat goldfish all day. We need to find something for it. So a couple more questions. We have Scott wondering, what about those frozen French fries that are made of whole potatoes, low oils that you find in the grocery store? What lighting would you give that?
Probably put it in not as bad as the red light food, but maybe yellow light. And one thing I could say is it's really easy to bake potatoes. So this is a dish that I make a lot. I buy Yukon Gold potatoes and I cut them into like fun shapes for my son. And I toss them with a little bit of what I call like high heat cooking oil. So I really like grapeseed oil or avocado oil. And, I think that if you do it that way and bake it for like 30 to 40 minutes, maybe mix it up halfway through on that like 450. Then I add a little garlic powder and salt at the end, try to keep the salt lowish.
Yeah.
It's probably a little healthier than what you're going to find in the frozen food aisle, but I don't think, if they truly are lower in oil and lower in salt, then it's probably not going to be the same as your, fast food French fries.
So that's great news. Just a couple more questions and then we'll finish. So you talked a little bit about fad diets. I'm just using that as the general Google term of keto or paleo or whatever. So do we have any studies comparing those type of diets to this whole food plant-based? And would you consider whole food plant-based a fad diet? I guess I know the answer, but just give us your perspective on that.
Yeah, so no, I think that's a great question. And I think whenever you look at diet, you always have to compare it to what is the other group eating. So if we're going to take the paleo diet and compare it to the standard American diet, the paleo diet is healthier. And I would even say that the paleo diet is probably healthier than what we call a junk food vegan diet. So vegan diet is pretty much an ethical diet, I think, where they avoid animal foods, but they could still eat a whole lot of crap that's not
food. Yeah.
There are studies that compare keto versus whole food plant-based for insulin resistance and weight gain. And whole food plant-based seems to help for both diabetes, weight gain, and the jury's still out on cancer. I think that's a harder population to study. We need more long-term studies, but we do know that a keto diet that's high in animal products, there's a lot of factors in animal products that can lead to cancer. As I mentioned, they're low in antioxidants. So they create reactive oxygen species. They have environmental contaminants that may be linked to cancer. They form these chemical compounds that high heat cooking that can be carcinogenic. They raise your level of IGF-1, which is a growth promoter, so a cancer growth promoter. So I personally think that I would really caution those type of diets for cancer patients. And definitely there's studies showing very clear correlations with colorectal cancer in animal products, breast cancer in animal products, and prostate cancer. So especially for those three, and I'm sure studies will come out down the road with other cancers as well, but
yeah, no, that's great. That answers the question. Thank you. And then the other question that's coming up is the relationship between fitness and nutrition. So yes, it's important to have this whole food plant-based diet, but where does fitness come in? What's that relationship look like?
Absolutely. Again, I can't say enough about that documentary, The Game Changers, because it's literally about athletic performance and athletes and diet. Fitness is really important. And I think mainly physical activity. Really, the more physical activity, the better. Don't overdo it. What you handle within your means. But exercise is sort of an independently beneficial to your health. And in terms of what you eat, I think, if you're extremely active, obviously you want to increase your calories overall to match that activity. You don't want to delve into unhealthy low weight for no reason. But there's really, whole food plant-based can be very healthy for very active individuals. So I think two independent things.
That's great. All right. Thank you so much for your presentation and for your time, Dr. Wehrli. We're going to end with a couple of announcements, and we apologize that we didn't get to all the questions, but we really appreciate your participation here with us today. So our next session in the Nutrition and Wellness for Myeloma chapter meeting will be on June 22nd, 2021. And we are going to be discussing healthy snacking. This is going to be by registered dietitian Katie Broswell. So she has spoken to a couple of my other chapters. She's really excited to come back and speak to you about how to find that snack and satiate your hunger. I think that's the word. I know we're over time, so I won't go all over all of these events, but these are the different upcoming events in the Myeloma Crowd Community Program. If you're interested in signing up for any of them, a couple highlighted ones is the Fitness for Myeloma chapter on June 2nd. That's finding your peace through Qigong. And Qigong, for those of you who don't know, is the practice of coordinated body posture and movement, breathing, and meditation. So please join us for any and all of these events that you find interesting. And then we also have the link below to find more events that aren't listed today. These slides will be sent out in the follow-up email within 48 hours of the conclusion of this event. And that's 48 business hours because I know it's Friday. Special thanks to our community event sponsors again, Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech, Oncopeptides, Takeda Oncology. And again, thank you to each of you for helping us build this strong myeloma crowd community. I appreciate your support, your questions, your participation. And of course, Dr. Wehrli, we're really grateful to you. So have a great rest of your day and have a good weekend. Thank you.